Hello and welcome to YouTube channel HealthQ, the HealthQ Talks, where our mission is to not only motivate you but help you to move on to the brighter side of the health. I'm your host physiotherapist Meghna Dave and I am a neuro rehab physiotherapist. After working for almost 14 years and helping people suffering from various movement related disorders, I've realized that there are some common patterns, there are some common issues that are the real cause behind the issues that a person experiences related to mobility. My intention behind doing these podcasts as well as the videos that we have created till now is to make you more aware about them and also to give you a solution and help you identify how you can work better towards it. So, today's topic that we are going to discuss is why do we experience chronic pain? Chronic pain is such a common problem that no one in this world is left without it. But this chronic pain is not just mere an injury based thing. There are a lot of factors that are associated with it. So, this particular podcast is for someone who is experiencing chronic pain or else who knows someone who is experiencing chronic pain. Why does chronic pain happens? What are the common factors, the day-to-day life challenges that triggers this chronic pain? We are going to discuss that. At the same time, we are also going to discuss why this pain triggers in our body. What are the factors that causes these triggers to get more chronic or else become more intense? And at the same time, we are also going to discuss about what are the lifestyle changes and modification that can help you to deal with this chronic pain. So if you feel that this is something that inspires you to work towards your chronic pain management, then definitely listen to this podcast till the end. Let's begin. Friends, we are living in a world where chronic pain has become a common thing. Back pain, we all know, has become like an endemic. Every third person experiences back pain at some point of time. If we look at the WHO data, by 2030, almost 2.4 billion people will suffer from movement-related disorders, and chronic pain is going to be a very integral part of that, which means that the need of rehabilitation service is going to increase. Why do you think this pain rate has increased tremendously? Now, if we look at the data again, since medical or else you can say modern medicine has gone tremendous amount of leaps and bound of growth in terms of prevention of infections as well as has been able to control infectious diseases, modern medicine has yet not found that breakthrough innovation helping people suffering from chronic lifestyle diseases. Let's say hypertension, diabetes, cancer in those terms. All of these conditions are at rise. Some common reason that we see is aging population is increasing. Since the medical management has become so advanced that people have got good lifespan, the aging population is also increasing. At the same time, since the sedentary lifestyle is becoming more and more at peak, it's also increasing the rate at which people experiences injuries. Now, injury doesn't have to be straightforward a fall-based injury or else a violent-based injury. There are bigger factors like stress injuries or else repetitive strain injury. The rate of these things are increasing. So, when aging population is increasing and the rate of injuries are increasing, what is going to happen? The comorbidities or else problems associated with these issues are also going to increase. And one very important problem that is associated with this is musculoskeletal or else movement related disorders, or else I can even say neuromuscular disorder. So why do you think that these needs to be addressed? Let's say every third person, if it is going to suffer from pain, then it's going to impact his or her productivity. The productivity impact is going to impact the companies or else the organization for which they are going to work. And when that will be impacted, eventually the financial status or else the economy of the countries or that organization is going to be impacted. So productivity of a single individual eventually impacts the productivity or growth of a company, right? So that doesn't apply only to organization and company. Let's say a woman staying at home also experiences a lot of injuries or movement related issues or suffers from chronic pain. What is going to happen due to that? It's going to impact her productivity, which eventually impact the productivity of the family members who are going outside and working. So if we want the growth of entire country, entire organization, we need to address this very big culprit of problem which is called as chronic pain. So now, since we are living in a world with incredible medical advancement, what is the first line of pain management? Obviously, it is pain medication. If you see from 1990 to 2000, the rate at which the pain medication has been prescribed has skyrocketed. And when people don't find solution from the pain management medicines, the people start moving towards surgeries. If you also see the data, the rate at which the elective surgeries has increased has been tremendous. Now, unfortunately, the way with which knee replacement surgeries and hip replacement surgery have got efficient results, back surgeries unfortunately have not shown that level of effectiveness and efficiency. That's why people, even after going through these surgeries, are not able to find the relief that they are looking forward for. So now, since we know how bad this pain has become, especially the back pains, but back pain are not alone. If you see the rate at which other conditions are exponentially growing, knee injuries, ankle injuries, repetitive strain injuries like tennis elbow, bicipital tendinitis, frozen shoulder, etc., they are also increasing at a faster pace. But what is the reason behind this? Now, pain is a real condition. It's a real problem. And almost 80% of people in this globe experience pain at some point in lifetime. Pain, but eventually or unfortunately, is not the problem. Because pain is just a messenger telling you that there is something which is going wrong in the body. So instead of addressing pain, we need to address the cause behind it, or else the problem behind that pain. Now, pain can basically be categorized in three important categories. One is called as neuropathic pain. The second pain is called as nociceptive pain, or third pain you can call it as neuroplastic pain. Now, what is the difference between these three kinds of pain? Let's talk first about very basic, and that is nociceptive pain. As simple as that, nociception means pain that you perceive just because of a physical injury. This physical injury can be direct or else indirect. But whenever there is a damage that has happened to the structure of a muscle or else a tendon or else ligament, at that time, whatever you are going to sense is going to be a nociceptive pain. There's going to be release of certain substances, some chemicals. These chemicals would be like protease, potassium, ATP. Now, what is going to happen when these are released? This release of substance is going to stimulate something called as nociceptors. Now, what are nociceptors? Now, to understand nociceptors, you should know what is central nervous system at first place. Our body has got a very sophisticated system which is called as central nervous system. You can call it as CPU of your body. This central nervous system is again divided in two parts. The central nervous system, which comprises of your brain and spinal cord, and your peripheral nervous system, which basically comprises of your autonomic system as well as your somatic system. Your somatic system is nothing but your muscles. Right now, this system basically takes all the information from different parts of the body, takes it to the brain or else to the spinal cord, the central area where all of these information is being processed and a response is sent back. So whenever your injury has happened, and that will irritate or else will activate something called as nociceptors. Now, nociceptors are nothing but your nerve endings or else the receptors which carry your pain sensation. Now, these nociceptors are basically of two kinds, beta fibers as well as C fibers. Now, what does A beta fiber and C fiber do? Now, let's understand that. Now, A beta fibers are nothing but your nerve endings which immediately or instantly carry the information from your nerve endings to your brain regarding an injury. These fibers have got good amount of insulation which is called as good myelination. This insulation quickly sends message to the brain that there is a danger or some problem existing in front of you. That danger response is processed in the brain and your brain sends an instant signal to pull you away from that area of cause. That's why whenever you are hurt, you will be able to immediately pull off your hand from that area where you see that potential damage because of the A beta fibers. But at the same time, there are also some nerve which is called as C fibers which carry your chronic sensation of pain, which are more of dull stabbing pain. So all the pain that you experience in a chronic form usually comes due to the activation of these C fibers. These C fibers have got less myelination, and that's why they reaches out to the brain little slowly. And these pain, that's why chronic pain basically are not that intense, are gentle, or I'll say are dull in nature, but aren't continuous in nature. So your nociception or else your nociceptive pain starts first with an intense pain, which we can call it as acute pain as well, and then gradually turns towards a very chronic pain, right? This is what is nociceptive pain all about. Now let's move on to the second type of pain, and that is called as your neuroplastic pain. Now what do you mean by neuroplastic pain? The pain that you experience due to habituation. Now you must have heard this term neuroplasticity. If not, let me tell you what is that. Well, neuroplasticity literally means ability of the brain to reorganize and regrow on its own based on the experiences and learnings that the brain receives from the environment. Neuroplasticity works in a way where everything that you do repeatedly gets processed in the brain and is coded in the brain as a memory. And that memory then helps to judge our future decision. Most of the habituated pain or chronic pain falls under this category, because once an acute pain sensation is repeatedly being activated, it's getting stored in your brain as a neuroplastic response, and that gives a sense of pain again and again. That's why whenever a nociceptive pain, when persists for a longer period of time, it takes the form of neuroplastic pain. The inflammatory response which is released when is continuously happening again and again, it is going to bring in change in your brain situation. It's going to activate your nociceptors again and again, which will cause that change in the pattern of response that your body give to that particular nociceptive response. And the third type of response, or the third type of pain that people usually experience, is called as your neuropathic pain. Now, neuropathic pain basically is the type of pain that starts from your nerves or your central nervous system. This is where your nerve damage or nerve injuries come into the picture. Any person who have got nerve injuries or spinal cord injury or brain injury, and the kind of pain that they experience falls into this category. Again, a neuropathic pain also turns and take the shape of neuroplastic pain. Whenever a neuropathic pain stays for a long period of time, it is going to eventually take the shape of a neuroplastic pain or else habitual pain. So that's what is the three types of common pain that we as human beings can experience. Now, that's not all. There are a lot of other factors that are going to impact or influence your pain. What are these factors? Let's talk first about injuries itself. Now, injuries directly look at damage, a physical damage that has happened to your body area, which is going to impact and cause pain. But along with that injury, what associatedly happens is some emotional response as well as the triggering of immune system, at the same time triggering of your stress response. All of these three things are happening simultaneously to give you an experience of pain. So pain is not that straightforward. It has a lot of other components associated with it. That's the reason. Even though pain is a protective mechanism, pain is designed to protect our body from further potential damage. When this pain persists, it's not good for you. And that's why chronic pain is not good for you, even though acute pain could be good for you. Now, what is the difference between acute pain and chronic pain? If you ask me literally, the basic difference between an acute pain and chronic pain is acute pain is temporary, chronic pain is something which lasts for longer than 15 days. Acute pain is a sign that the body is giving that there is something wrong going on in the body, but chronic pain itself is a mistake that body has taken as permanent. Third important factor that is good about acute pain is it gets restored over a period of time. But chronic pain needs more than extra effort to bring that under control. Fourth important aspect about acute pain is that acute pain are mostly injury based, whether it could be from a musculoskeletal injury or its musculoskeletal origin, or else it could be from a central nervous system or central origin. Chronic pain, on contrary, is more from experiences and the hard changes that your brain is going through. Acute pain can be managed with some acute management methods like medication, physical therapy, massage techniques, etc. Chronic pain, on contrary, requires a lot of self-work, where lifestyle modification plays a very crucial role. Hence, you can see faster results in acute pain management, and little long-term results can only be achieved when chronic pain is managed in a step-by-step manner. Role of emotions in pain. So now, since we understood what is the difference between chronic pain and acute pain, there are many factors, more important factors that needs to be addressed, which is rarely addressed these days. And that is the role of emotions, stress, anxiety, depression that has its role on the management of chronic pain or its causation of chronic pain. Now, chronic pain is very different from acute pain, which you have already understood. And that's why these factors needs to be addressed, because these are the leading problem behind chronic pain. So let's first discuss about the role that emotions play in your response to chronic pain or pain itself. Pain can be a confusing experience to anyone, because there are a lot of things that's going on and the body gets confused from where this pain is coming from. In initial days, it's okay because it's just a stress response that the body is going through, or else inflammatory response that the body is going through due to an injury. But when that injury, that stress response is out, but still the body is experiencing pain again and again and inflammation again and again, body gets confused. This leads to a lot of thought creation. Since emotions like fear, emotions like helplessness, emotion like sadness comes into the picture. So even though pain experiences like a bodily experience, but it's actually starting from brain. The emotional part of our brain, like cingulate complex, amygdala, and the insular cortex are basically responsible to process the emotion that we experience, and are also responsible for the unpleasantness that we experience due to pain. So more the areas are activated, the more likely that we are to experience this pain. The good part about pain relief is that we are already blessed with some natural opioids or else pain relievers like dopamine and endorphins. But whenever our body is going through constant pain or constant emotional stressors, the endorphin release and dopamine release also reduces. Let's say, for example, for a body, it's good to go through stress. That's a natural instinct that we are born with. But whenever that stress is happening again and again, and the body does not get that time to relax and come back to that state of relaxation, the endorphins and the dopamine that needs to be released, they are released less in quantity, and over a period of time, a person gets sensitized to that pain and the body stops releasing these hormones and we start losing control over these emotions. That's why stress is a very major factor that needs to be brought under control. Now, we must not have thought of pain as coming from the stress response, but now hear me out. Stress is a response that your body gives through to a negative experience. This negative experience could be emotional, physical, mental, or any other sort of. Whenever there is a stress response, what is happening inside the body, the physiological change that is happening inside the body triggers your pain response again and again. Whenever we perceive stress, there is a release of series of hormones. Hormones like estrogen. The brain will also trigger your adrenal glands, which releases a stress hormone which is called as glucocorticoid. Now these glucocorticoid needs to bind with the glucocorticoid receptors. These glucocorticoid receptors are basically present in almost entire cells of the body. Now what these glucocorticoids do? They suppress your immune response so that the body can focus only on fighting with that stressor. That's why the body starts increasing release of the immune cells. There is more glucose in the bloodstream which is required to fight these immune response or as these cells. Now, whenever the stress is constantly active, the body starts getting deprived of this glucose that is released from the brain, from the adrenal gland. And that's why the body has a very elevated high sugar level, and that's how people develop insulin resistance as well sometimes. That's the reason it is not a surprising fact that people with diabetes have got higher rate of stress, higher rate of pain, and higher rate of delay in healing response compared to other people. Also, whenever there is more glucose in your bloodstream, this would happen to ensure that there is good and constant source of energy present in the body. This will improve the memory of the events inside the brain, which will give you strong emotions. Now, what do I mean by this? Whenever you are experiencing an injury, and this injury or the stress response is coming again and again, stress response is released again and again, the body is in constant state of fight and flight mode. In this state, the levels of energy in the body needs to be high. Now, whenever that is happening, the body is also doing an emotional perception of all of those things, which is also getting hardwired inside the brain due to your neuroplasticity, which I explained you before. So what is happening eventually is that your brain does not get time to get out of that stress response, which eventually leads to a stronger memory of pain. So over a period of time, what is going to happen is this becomes a habit for the body, that there's always a stress, there's always an increase in blood glucose in the bloodstream. At the same time, there is always an increased level of stress, emotional or mental stress present in the body. So overthinking, anxiety, stress becomes common. And direct impact of all of these things. Whenever there is more overthinking, more stress, more anxiety, the muscle also responds to them in the form of contraction. Your muscle stays more contracted, more tight, more stressed out, which does not allow these muscles to relax in the time where you are actually not in the phase of stress. This gives a constant state of injury and gives a chronic pain to an individual. Ironically, hippocampus, which is a memory area of our brain, also have a very crucial role into all of these, because your brain is constantly registering every experience that your body is going through. This experience is also being registered by hippocampus. Now, studies have shown that people who have got chronic pain has got higher or else more sensitive hippocampal areas to this region. Also, hippocampus play a role in inhibiting the glucocorticoid level in the body. So, eventually what happens, the more we stress out, the more damage is happening to the hippocampus. So, there is less inhibition of the glucocorticoid level in the brain or else in the body. So, the more stress we experience and the more damage happens to the body. So, this becomes like a vicious cycle. Everything is revolving around that emotional experience, the change in the brain and the pain experience. And it's adding up with every single episode. But it's not only at the hippocampus. There's one more area in our brain which is called as amygdala, which is an emotional controller also, which is associated with the limbic system in the body. Now, what will happen is, since there is a high level of glucocorticoids in the body, it's going to activate the amygdala again and again and again, which keeps your body in high alert level, high arousal level, stimulating neuron growth and making these synapses more active, more sensitive. So, what is going to happen? When your amygdala is more active, more sensitive, your pain sensation is going to be intensified. And this intensified pain sensation is going to become a source of chronic pain. So even when you are not actually going through any physical damage, it is going to feel like there's a chronic pain that is constantly coming to your body. So now, since we know that stress has a major response, let's talk about anxiety. What is the difference between stress and anxiety? Whenever your stress is happening again and again and again, it's going to impact your emotional well-being. That's very obvious. And this emotional well-being leads to this problem which is called as anxiety. Now, what is anxiety? Anxiety is a constant feeling of overthinking or is constant state of worrying. Whenever you are feeling this constant urge of worry, of anger, despair or any sort of emotion, and you're finding difficult to distract yourself from that worry, at that time it turns out to be an anxiety disorder. There are so many people who have got chronic pain have this fear and this habit of overthinking and over worrying about their problem. This becomes so bad sometimes that they start refraining themselves from socializing and doing some basic activities, basic chores of day-to-day life which they used to do normally. This anxiety disorders eventually then turns up into depression. Now, there is a difference between anxiety and depression. Depression is a medical condition itself. It's a condition in which a person eventually feels sadness even in the situation where he would be more excited in usual scenarios. This feeling of sadness is also associated with a constant state of lethargy and this lack of desire to stay active. Now, whenever you are not physically active, you are not releasing more dopamine in the body, more endorphins in the body, which are your natural happy hormones, which are your natural body exciters and natural pain relievers. So, it has again turned up like a vicious cycle. When you are not able to feel happy, not able to feel excited about anything, you don't feel like moving. When you don't move, there is less release of hormones, happy hormones in the body. When there is less release of happy hormones in the body, you again land up into that anxiety state, into that stress state. Whenever there is a constant stress response going on in the body, there would be high glucocorticoid level in the brain, in the bloodstream. Whenever there would be high glucocorticoid level in the bloodstream, the muscles cannot relax, the brain cannot relax, the muscles constantly stay contracted, and whenever these muscles constantly stay contracted, what is eventually going to happen? There is going to be a constant injuries that your muscles will go through. This constant injury will cause different musculoskeletal or pain related conditions to develop. Some of the common conditions, let me tell you, which people consider as physical disorders, eventually starts with this vicious cycle. Now, some names would be new, but some names you would have definitely heard of before. So let me talk about some of the common conditions which turns out chronic, which we see people experiencing in day-to-day life and have actually become very common and as a part of lifestyle for many people. These conditions are, number one I would like to talk about here is fibromyalgia, which is a neglected problem, I believe. Fibromyalgia is a condition where a person experiences pain, fatigue, at the same time some tenderness and moving areas of pain in different parts of the body. Earlier, the diagnostic tool was the common points throughout the body, which are the markers for fibromyalgia. But recent studies have found out that pain is always associated with feeling of distress, anxiety, and at the same time associated movement challenges. Fibromyalgia is a condition which is common in women, and a very direct link to that is the fluctuating estrogen levels in hormones of women. At the same time, even though male experiences pain, but it is less reported because males usually don't like to share or talk about their pain more. So many a times doctors usually dismiss this diagnosis considering that it could come from an aging or else degenerative process, but many a times it's a fibromyalgia condition which has a very direct link with the stress, anxiety as well as depression. Now, along with fibromyalgia, the other condition that is very common is muscle spasms. Now, every now and then people develop muscle spasm, maybe in neck, in shoulder, in calf, in hip, etc. For few, it just comes and goes away, but for few, it lasts. And for few, it becomes very frequent. In all of these situations, it's going to increase again and again because of the neuroplastic changes that your body goes through. Next is sciatica. Many people believe sciatica is happening due to irritation on your nerve around the spinal cord. But people usually find difficult to get out of this problem, the reason being tight hip and spine muscles, which is again an habitual process. Plantar fasciitis. Why it happens? Plantar fasciitis usually happens among people who have got poor weight bearing patterns when they stand, sit, walk, etc. This is again an habitual process due to an imbalance in the musculoskeletal system. But these are not all. Carpal tunnel syndrome, bicipital tendinitis, tennis elbow, adhesive capsulitis or frozen shoulder, bursitis, tendinopathy, tension headaches, migraine. All of these starts from this common origin or starts with an acute problem but turn chronic due to the lack of lifestyle changes and lack of awareness about the lifestyle implication that people don't know about. So since we know that these are the sources of pain and this is how your lifestyle has got a clear and direct impact on your musculoskeletal or else your pain, we should also know how to deal with it. So let's talk about how you can deal with this chronic pain. Since we know chronic pain is more of a lifestyle related issue rather than physical issue itself, even though physical issue cannot be ignored, It needs to be addressed. But here, you need to work with your therapist rather than your therapist working on you. So, whenever there is an acute pain, yes, you need therapy. You need to go to a doctor and work on it. But at the same time, it's equally important that you work on your lifestyle. So make sure to involve yourself in talk therapy. Whenever your emotions are under control, you would be able to control everything else in your life. So working on your emotional is very important. If you have this habit of overthinking, constant worrying, do simple thing. Write down all the problems that is cause of overthinking and objectively try to think what you can do about it. It's not just mental awareness that requires building, but it's the mental fitness that you need to work on. Very similar to your physical fitness, your mental fitness is equally important. And tools like talking to people, journaling, writing down your problem and writing solution to that problem, doing meditation, doing breathing exercise, pranayama are simple but very effective ways that help you to work on your mental fitness. I cannot stress less on this. Your mental fitness matters the most. So take care of your mental fitness. The second important thing is to use techniques like visualization and graded motor imagery whenever required. Now, visualization and graded motor imagery are some of the amazing tools that works on your neuroplasticity, where you are basically tricking your brain to get back to normal. Since the problem is everywhere starting at your brain level, we need to address at brain level itself. So visualization is nothing but a practice of recalling or visualizing literally all the movements. Studies have shown that athletes can enhance their performance by visualizing their practice, visualizing their performance again and again without physically contracting their muscle. A very beautiful way, even though it takes a lot of time, a lot of practice and a lot of precision, but it's worth it. But at the same time, graded motor imagery is a breathtaking and a very effective pain management method which is rarely being used, which has been used and studies have proven is very effective in dealing with pain. There was a very famous Dr. Ramachandran who came up with this method of graded motor imagery. Not exactly, but he used mirror therapy basically to help amputees. So what he did was he placed amputee, or else he asked amputees to stand in front of mirror, hiding the affected side and making the exercise to be done in front of mirror using the normal side. This way he tricked the brain, and a amputee literally felt that his limb which was missing and was causing pain is being moved, and whenever it gets moved, the pain is relieved for him. That same principle has got tremendous amount of appreciation. A lot of work has been done further, and it has been figured out that with the help of mirror therapy, the brain can be tricked and your pain relief can be achieved. A very rare practice used, but very effective practice. Next is, I can stress again more on this, is keep moving. Whenever we feel pain, we feel not to move, but that's not the solution. The solution lies in the opposite way around. Whenever you feel chronic pain, it's very important for you to move, whether it's painful or not. But whenever you will move, you will break those barriers. You will retrain your brain to move back. You will reduce the level of glucocorticoids on your brain or your bloodstream, and will increase the level of dopamine and endorphins in the brain. This dopamine and endorphins will help you to feel better, will help you to get out of stress, get out of anxiety, get out of depression, and will help you to move better. The third thing which is important is to move smart and not hard. Now, tricky movements, we all do it. And the tricky movements are the cause for pain as well. They are cause for injuries as well. The wrong patterns that we develop as a habit eventually is the cause for all of those things. So make sure that you be watchful in what are the patterns of movement that you are doing. Use mirrors. Use your own observation. Develop that awareness about your movements, awareness about your postures, and start working on it. Don't fixate on your pain. Now, there are many people who overthink about their pain so much that itself becomes a cause of pain. Many a times, if you are overthinking, you are increasing your stress response, you are developing anxiety within yourself, and could lead you to depression state, which is a very big cause for your pain. So make sure that you start distracting yourself by doing meditation, by talking to people, or else simply doing your breathing exercise. Remember, whenever you are in stress, start taking shallow breaths and will not be able to use your diaphragm in your breathing. So take a pause, observe your breathing pattern, correct it, and don't fixate on your thoughts of pain. The next thing that you need to do is to improve your proprioception. Your proprioception is the sense that you have received that gives you an awareness about your body's position in space. Whenever you're sitting, whenever you're moving, you can sense where your body is aligned. This awareness, somehow we stop putting focus on, and is the leading cause for the wrong postural pattern. So start reworking on that awareness by relying a lot on your proprioception. A simple way to do that is just close your eyes and just try moving the area which is painful for you. You will get a sense of where your joint position is compared to your normal side, and that's the beginning of working of your recovery part. So make sure to work on your proprioceptive system. The next thing that you need to do is standing posture exercise. Your standing posture says a lot about your muscular system and also a lot about your chronic pain. If you are in chronic pain, definitely your standing posture will be altered, which requires correction. And that's why standing posture awareness also plays a crucial role. You can take help of mirror to work on your standing posture. Another beautiful way of working on your chronic pain is doing sitting posture exercise. Now we have come up with an amazing safe exercise program which is basically about improving your sitting posture exercise. If you want to know more about it, make sure to comment yes in the comment section below so we can come up with a demonstration of your sitting posture exercise. Few other things that you should also focus on is driving pattern. How you drive, what is your posture while you are driving. Make sure that your spine is well supported in your back. You are not keeping your shoulders, your back very stiff while driving because of fear or whatever is the reason. Be at ease, because that tight shoulder, the struck shoulder, is going to cause a lot of problem in your neck muscle. So many people experience neck pain, back pain post driving just because of those tensed muscles that they constantly keep while driving. Similar thing applies to your phone. Make sure whenever you are using phone, don't lift your shoulder or shrug your shoulder and bend your neck, because that's going to impact your positioning of your shoulders and the neck region, is going to irritate this area and is going to cause pain. Same thing also applies on your computer. Make sure whenever you're working in front of your computers, this height of the computers should be raised at your eye level. So there is not constant neck bending, but at the same time your computer should not be too high that your neck is constantly in upward position. That's going to cause pain again. So that needs to be also addressed. Also make sure the way you sit in couch is proper. Now, many of us has habit of being couch potato when it comes to couch. We just lie down without bothering about our posture. So many people who started working from home recently developed a lot of pain related issues just because they were working while sitting on their couches, which are so soft and so comfy that it actually hampers the alignment of your spine, causes a lot of overwork and gives a lot of pain. Also be careful about your sleeping position. Make sure that the pillows that you are using are not too high, not too low. It's also not a good idea to sleep without pillow. Many people think that if I have got neck pain, I should not use pillow because that will give some relief, but that's also a myth. Sleeping without pillow is also going to cause a lot of hyper side bending and is going to cause a lot of compression on your spine muscles and is going to give you a lot of pain. So be aware of that as well. Another important thing that I would like to address here is choose your footwear right. Your footwear can alter and correct the alignment of your body. So make sure that your footwear is well supported, is soft enough but not too soft that your foot completely sinks in, and not hard enough that it doesn't get good support and actually hurts your foot muscles as well as the sole of your foot. So a footwear which is well supportive, moderately soft and have got a very slight heel is good enough for your foot. Also, many people have got this habit of trying to look more stiff, more tough, more erect. That's also not good, because wherever you are trying to do that, you are tensing your muscles. Many people, wherever they are at work or else wherever they are in meetings, they try to sit erect just to look better. But in that context, they are stiffening or else contracting their muscle and keeping them under tension, which is also going to cause a lot of problem. So make sure that you avoid that as well. Make self-care your priority. Make sure to find time for yourself, meditating, doing exercise, or whatever it takes to keep your health, not only from your musculoskeletal system perspective, but from your mental well-being perspective as well. Constantly keep on working towards your well-being. Some days cheat meals are fine, but make sure you don't indulge into a lot of unhealthy food, because that's also something that's going to be a culprit of your chronic pain. And last but not the least, don't expect changes to happen overnight. Good things progress takes time. So be patient with yourself, be easy on yourself, and let your body take charge back of you than your mind. So this was all about chronic pain. I hope you found this video helpful. If yes, make sure to like this video, make sure to subscribe, and make sure to watch more upcoming videos. On that note, this is Meghna Dave signing off.